Hello everyone, myself Dr. Sunil Kumar Tangaraju, consultant surgical oncologist at Ganga Hospital, Coimbatore. Today, we are going to see a case of carcinoma cecum with involvement of psoas muscle for which a radical right hemicolectomy Enblock with the psoas muscle was done along with a deep 3 lymph nodal clearance. This video depicts the importance of assessing the critical structures in a CT scan and the importance of open surgery even in the era of laparoscopic surgery. This patient was evaluated elsewhere and was deemed inoperable. He was started on chemotherapy and bevacizumab. He presented with repeated infection due to psoas muscle abscess. A pigtail was inserted to drain the abscess, but the infection persisted due to the perforation of the cecum into the psoas muscle. Was carefully evaluated. Now we can see the second and the third part of the duodenum is free. The ascending colon is filled with fecal matter. The kidney is free until the lower pole. Till now we can't see the mass. The superior mesenteric vessels are far away. The mesentery is free. The mesentery does not have any fat stranding. Now we can see the cecal mass which is enhancing, and the induration is extending posteriorly close to the iliac bone and into the psoas muscle. We can see pockets of fluid into the psoas muscle, and that is the abscess. The ureter is stented, which can be clearly seen, and the external iliac vessels are free from the psoas muscle. The critical structures that are the lower pole of the kidney, duodenum, the external iliac vessels and the ureters are very much free. Hence, it highlights the importance of reviewing the CT scan although deemed inoperable at a different place. This is the operative notes where they have assessed laparoscopically and deemed inoperable. The challenges in taking up this case were patient was started already on Meropenam and tecoplanin. Just 10 days later, after giving the last dose of bevacizumab, which is known to increase the risk of bleeding and wound healing problems, is a known case of diabetic and also meigs syndrome. So we did a radical resection of right hemicolectomy along with the psoas. This is the post-operative bed which shows the lower pole of the kidney, cut end of the femoral nerve, iliac bone and the ureter. The procedure went uneventfully. Patient was carefully evaluated in the post-operative period and was discharged on 8th post-operative day. The specimen showing the radical right hemicolectomy Enblock with the psoas muscle and D3 lymph nodal. This was the incision that was used for the surgery. The histopathology reveals that the tumor is confined to the serosa. There is no communication with the perforation of the psoas muscle. 26 lymph nodes were harvested. All the lymph nodes are free of tumor. It's a PT3N0 disease and it's a curative resection. Otherwise, patient would have had chemotherapy until his death. Thank you. For any details, contact the WhatsApp and the mail ID.